Welcome back to Have More Babies. We are launching straight into a really critical topic today, one that, well, touches almost every family at some point. This is your dedicated deep dive where we take, complex medical info and synthesize it into genuinely usable, clear knowledge for you. Okay, let's unpack this. Our focus is pediatric skin health. Specifically, we're looking at dermatitis, understanding and managing skin inflammation in children. Our insights today are pulled directly from the expertise shared by Omega Pediatrics, and our mission is to go beyond just definitions. We want to understand the different forms dermatitis takes, identify those subtle triggers, and, most importantly, give you clear strategies for relief.
For comfort.
Yeah, and what's fascinating here is how often dermatitis is, well, misunderstood. It's basically the skin's SOS signal, right? It presents as an incredibly common condition, but it can be really frustrating. So when we talk about dermatitis, we're using like a general term for any skin inflammation. You're looking at redness, itchiness, just general discomfort. That distinction is key, isn't it? Because when a child's struggling with a rash, the first question is always, which rash is it? You're not just seeing inflammation, you're looking for clues. Clues that point to a specific type of problem.
Exactly. And the sources guide us by outlining 3 main types, which is really critical because how you manage it, well, it changes based on the root cause.
Okay, so let's start with the one most people recognize.
That would be atopic dermatitis. Pretty much everyone knows it as eczema. This is the big one, the most common. It's chronic and often the most challenging. The sources point to a strong hereditary link. So if parents or siblings have asthma, hay fever, or eczema themselves, the child's got a higher chance of developing it too.
And when a dermatologist is looking at atopic dermatitis, what's like the telltale sign for parents listening in? What should they look for?
Well, beyond the dry, inflamed patches that just won't go away, experts often look for what's called the classic flexural pattern. This means the rash tends to pop up in the creases. Think inner elbows, behind the knees, around the neck. That specific location is often the first major clue differentiating it from other types.
Okay, flexural pattern. Got it. What's next?
So moving on, the second key type is contact dermatitis. And this one is defined strictly by, external interaction. Something touched the skin and caused a reaction.
Now, this is where it gets a bit nuanced, right? When we say contact, are we talking about the skin being physically damaged, or is it more the immune system reacting?
That's a really important question, actually. Contact dermatitis breaks down into 2 different mechanisms. First, there's irritant contact dermatitis. This is where a chemical, maybe a harsh soap or even something acidic, physically damages or strips that protective outer layer of the skin. This doesn't require an allergy. It's just, direct damage.
Okay, direct damage, like a chemical burn almost.
Sort of, yeah. Then the second type is allergic contact dermatitis. Now, this is a true immune system overreaction to a specific substance. Things like nickel in jewelry, poison ivy, or sometimes specific ingredients in perfumes or dyes. And understanding that difference is really vital for treatment because one needs shielding the skin, barrier creams, that sort of thing. The other needs detective work to avoid that specific allergen, rigorous avoidance.
Fascinating. So irritant means barrier protection, allergic means detective work.
Okay.
And the third usual suspect.
That's seborrheic dermatitis. You often see this in areas rich in oil glands. In babies, we usually see it as cradle cap on the scalp, but in older kids, it can look like flaky, maybe kind of greasy scales, often around the nose, eyebrows, maybe ears.
All right, so we've got the categories: atopic, contact, seborrheic. Now let's dive into the practical side. Here's where it gets really interesting for a parent trying to break that cycle, figuring out what's actually causing the itch, pinpointing the triggers.
Yeah, and pediatricians often group the causes into 3 critical buckets. Tracking these is maybe the most useful thing you can take away from this step dive. It's really the cornerstone of making those lifestyle changes work.
Okay, bucket number 1.
Bucket number 1 is allergens. These are the immune system triggers we mentioned before. Things like dust mites, pollen, pet dander, maybe certain food sensitivities. A child with atopic dermatitis, the eczema type, is more likely to have these related allergies.
Makes sense. Bucket number 2.
Irritants. This is the one that sneakily hides in everyday products. We're talking about substances that physically damage that skin barrier.
Things we use all the time without thinking.
Exactly. Harsh soaps, detergents, especially ones with strong surfactants that strip away the skin's natural oils. But a major culprit, one the sources mention again and again, is fragrances. Fragrances aren't just common irritants, they're also a leading cause of allergic contact dermatitis.
Huh.
And they're everywhere, right? Laundry soap, shampoos, even lotions that seem gentle. Getting rid of scented products is often step one in managing chronic skin inflammation.
That's a huge takeaway. Check for fragrances. Okay, in the third category, this one sounds tough.
It can be. It's environmental factors. These are external pressures that just stress the skin system. Extreme swings in humidity, for example, too dry or too damp, both can trigger flares. Rapid temperature changes, like going from a warm house out into cold air, that's a stressor. And maybe the most complex factor noted is, well, emotional stress.
That's powerful. Stress isn't just in the head, it causes physical reactions. And the experts note this environmental stress factor is maybe the trickiest, because how do you consistently manage a kid's anxiety or hormonal shifts? It takes a different kind of vigilance than just switching laundry soap, doesn't it?
It absolutely does. So, okay, when a family comes in with these symptoms, how do doctors move from just looking to getting a confident diagnosis? They usually rely on a pretty methodical three-step
That
process.
first step is the most straightforward, right? Just looking.
Pretty much. A thorough clinical examination. The doctor isn't just glancing at the rash, they're noting its pattern, how severe it is, where it is. Is it in those creases, suggesting eczema? Is it in lines, maybe suggesting poison ivy or another contact issue? This visual assessment really guides what comes next.
Okay. Step two.
Secondly, especially if they suspect contact dermatitis, they might use patch testing. And this isn't a blood test, it's different. They apply tiny samples of suspected allergens or irritants, things like dyes, chemicals, metals, onto the skin under patches. Leave them there for a couple of days, then check for a localized reaction. It helps pinpoint that specific environmental trigger.
Right, like the detective work you mentioned.
Exactly. And finally, step three. They review the family history. This ties back to that hereditary factor we talked about with eczema. Knowing if there's a genetic predisposition helps confirm the underlying mechanism, especially for atopic dermatitis.
Okay, so clinical exam, maybe patch testing, and family history.
Right. And this raises an important question, though. Once a child is diagnosed, and you know the mechanism, how do parents and doctors work together? How do you move from understanding it to actually getting long-term relief?
Relief seems to be a combo platter. Targeted medical care, definitely. But also, crucially, that diligent, proactive home management. Medically, the sources focus on stopping the acute inflammation first and breaking that awful itch-scratch cycle.
Mm-hmm.
For the inflammation itself, the main medical tools are topical creams. These might include low-dose topical steroids for those bad flare-ups just to calm things down quickly. But for longer-term management, especially on sensitive skin areas, doctors often go for steroid-sparing options.
Yeah, and this is where we need to be clear on the terms. One key steroid-sparing option mentioned are calcineurin inhibitors. These are not steroids. They work differently, targeting specific immune cells right there in the skin to reduce the inflammation locally.
Huh.
And they're valuable because you can often use them more safely over longer periods and on thinner skin, like the face, which is helpful for chronic conditions like eczema without the side effects you worry about with long-term steroid use.
Got it. Calcineurin inhibitors. Good to know. What about the itching? That drives everyone crazy.
Oh, absolutely. It prevents sleep, leads to scratching, which just damages the skin barrier more.
Yeah.
It's a vicious cycle. So, oral medication like antihistamines are often used, especially at night, to help break that cycle and allow for some sleep.
But the linchpin, right, the thing that really makes the difference long-term and prevents it coming back, that seems to be the lifestyle changes, that proactive home care. This is where a parent basically becomes a master of moisturizer.
Absolutely. That's a great way to put it. The goal is all about repairing and protecting that skin barrier. The experts recommend something often called the soak and seal method. Have you heard of this?
I think so. Lukewarm bath. Right?
Exactly. A lukewarm bath, never hot, because heat makes itching worse for about 10 minutes or so.
And then the seal part.
Immediately after the bath, you gently pat the skin almost dry, leave it just slightly damp, and then right away apply a thick barrier cream or ointment. This traps the moisture in the skin. And consistently using a thick barrier cream isn't just about moisturizing, it's like physically replacing the skin's damaged outer layer. It acts like a shield against more irritants getting in.
Wow, soak and seal. That sounds really practical. Okay, so beyond prescriptions and this soak and seal routine, are there simple home remedies? Things for immediate comfort when that intense itching just hits.
Definitely. For soothing, widespread irritation, oatmeal baths using colloidal oatmeal, the finely ground kind, are really effective. The compounds in oats are naturally anti-inflammatory.
Okay, oatmeal baths. What else?
For daily maintenance, coconut oil is specifically mentioned as a natural option. It acts as a very effective occlusive barrier, locking moisture in. Of course, parents need to make sure their child doesn't have an allergy to coconut first. That's important.
Good point.
And then, when that itch just becomes unbearable, like right now, a simple cool compress can provide immediate relief. It constricts the blood vessels and kind of numbs the area.
Simple but effective.
Yeah.
Cool compress. Okay, so what does this all mean then? Taking it all together. It means managing pediatric dermatitis is really a comprehensive approach, isn't it? It's about being a bit of a medical detective, figuring out the type, the triggers, then combining that targeted medical guidance
Right, like the calcineurin inhibitors.
with consistently applying those proactive environmental changes and home care routines, like soak and seal, all aimed at keeping that skin barrier intact.
Exactly. And this whole approach, this holistic, proactive view, it's fundamental to where this information came from. This deep dive was based on sources from Omega Pediatrics, and they really emphasized providing a complete pediatric toolkit. They offered a whole range of services way beyond just skin issues.
Right.
They understand that managing something chronic like dermatitis is just one piece of the puzzle for overall child health. They provide everything from basic, acute, and preventive care to essential after-hours care, which is huge for parents.
Oh, definitely.
Plus necessary services like immunizations, lactation services for new moms, obesity medicine, and even specific procedures like newborn circumcision and medical ear piercings.
That broad scope is really reassuring for families, knowing they have one place for so many needs. And the accessibility piece you mentioned, for families in Georgia covering areas like Roswell, Alpharetta, Marietta, Buckhead, Canton, that's key. Plus, accepting a wide range of insurance like Blue Cross Blue Shield GA, Cigna, Humana, TRICARE, Peach State Health Plan. That makes a difference.
It makes a huge difference because when you have reliable care for everything else, it allows parents to really focus on managing specialized issues like dermatitis with more confidence.
Absolutely. Okay, let's do a quick recap of what we covered. We defined dermatitis as the skin's SOS signal. Clarified the three main types: atopic, eczema, contact, irritant versus allergic, and seborrheic. We detailed the causes: allergens, irritants like fragrances, and those tricky environmental factors like stress and humidity. And we looked at the comprehensive strategies for relief, combining medical treatments, maybe calcineurin inhibitors, with crucial home care like soak and seal. Now, here's a little something provocative for you to think about as you process all this. Given that figuring out triggers is so important, which environmental factor we discussed the daily reality of emotional stress, those rapid temperature swings, or hidden fragrances in common products? Which one do you think is the absolute hardest for a parent to consistently control for a child with chronic dermatitis? Just something to chew on as you think about achieving that long-term comfort.
Yeah, that's a tough one. And on that note, if you found this synthesized information helpful, or, if you're currently looking for expert comprehensive advice on dermatitis or really any children's health topic, we really urge you to find more helpful tips and resources like the ones we've summarized here today.
To explore the full range of services that Omega Pediatrics offers, read related deep dives on their site, and get the support you need, please visit omegapediatrics.com. That's OMEGAPEDIATRICS.com.
And if you appreciated this deep dive, and maybe the time we saved you sorting through all this complex info, please take just a second to like the video, subscribe to the channel, and share this video with anyone else who might need this information about children's health.
Thank you so much for diving deep with us today. We really hope this knowledge serves you well.
Goodbye. Thank you.